morning, I will be talking about compression-ischemic neuropathy and carpal tunnel syndrome. So, firstly, about compression-ischemic neuropathies. These is or the tunnel syndromes, which are the clinical symptoms complexes caused by compression in the nerves and blood vessel in the anatomical canals or tunnels. These tunnels are natural anatomical structures formed by muscles, ligaments, fascia, tendons, and bones. Since one of the leading roles in the pathogenesis of these symptoms belongs to the ischemic factor arising from the concomitant compression of the arteries and veins and of the nerves itself, there is a term describing such pathological condition which is called as compression ischemic neuropathies. There are more than 30 forms of tunnel neuropathies which have been described. So, pathophysiology of nerve trunk compression. Compression in combination with total and subtotal ischemia leads to the damage of all interneural tissues, including Schwann cells, nerve fibers, and the interneural vessels. The disruption of the microcirculation of the nerve fibers is accompanied by the increase in the membrane permeability of the proteins. This leads to coma, and that after long ischemic period when the compression of the nerve stops, intraneural remains. Then intrafascial vessels are especially resistant to ischemia. Ischemia lasting for 6 hours is characterized by complete restoration of microcirculation. At the same time, release of profibrinolysin factors by the endothelium of endothelial vessel is noted. Prolonged ischemia more than 8 hours is accompanied by symptoms of edema of the nerve trunks. So as you can see in the diagram, we can see 3 types of nerve damage by compression. It can be neuropraxia, then exotemesis, and neuroptomesis, in which the nerve is fully damaged. Then the carpal tunnel syndrome, which is the most common type of widely studied nerve entrapment syndrome. It's caused by compression of median nerve at the wrist. It passes through the space limited to the osteofibrous canal. The canal known as carpal tunnel contains the wrist bones, transverse carpal ligament, median nerve, and the digital flexor tendons. Edema, tendon inflammation, hormonal changes, and manual activity can contribute to increased nerve compression and sometimes cause the pain. As in the case of tendon inflammation, in the most severe cases, weakness of the medial nerve innervated muscles can occur, resulting in the hand weakness, as you can see in the diagram. This is the clinical picture of the carpal tunnel syndrome. Then the risk factor and the causes. The causes of mixed factor is carpal tunnel syndrome are abbreviated by median TRAP. So M means mixed edema, then E refers to edema, then D is diabetes, then I may be idiopathic, A is for acromegaly, and N is for neoplasm, and T is for trauma, R is for rheumatoid arthritis, A is for amyloidosis, and P is for pregnancy. So this is abbreviation median TRAP, for which are the causes for carpal tunnel syndrome. Then the medical risk factors can be divided into 4 categories. The external factor, first one is the external factor that increase the volume within the tunnel, outside or inside of the nerve. Then intrinsic factor within the nerve that increase the volume within the tunnel. The third is intrinsic factor that after contour of the tunnel, and the fourth one is the neuropathic factors. Then the clinical features of the carpal tunnel syndrome is usually characterized by symptoms in the hand. So in severe cases can spread proximally to the forearm, upper arm, and sometimes the shoulder. When patients with carpal tunnel syndrome are asked specifically where the pain and sensory symptoms are, they usually report that in the proximal symptoms are characterized by pain and not by numbness, tingling, or other sensory abnormalities. The frequently observed pattern of sensory abnormalities might be secondary to the peripheral or the central nervous system mechanism, simultaneous ulnar involvement or the central sensitization respectively, or the both. The evidence suggests that the symptoms being limited to the first 3 digits might indicate the more severe median nerve involvement, that is, distribution of the symptoms in the area innervated by the median nerve is associated with more severe changes in nerve conduction velocity. So we can see this is the ultrasound for CTS. The you can see in the black one, the more black one area is the carpal tunnel, and it is compressed by all the interesting and extensive factors. Then the differential diagnosis. Besides the history, neurological assessment and the nerve conduction studies can help distinguish between carpal tunnel syndrome and other disorders. So main one is the cervical radiopathy is the primary disorder that might be confused with carpal tunnel syndrome. Cervical radiculopathy is usually characterized by pain in the neck with the radiation sometimes exacerbated by rotation, flexion, or the extension of the head to the upper limb, more often to the typical dermatomal distribution. Needle electrography, electromyography, and cervical spine imaging can be useful in differentiating cervical radiculopathy from carpal tunnel syndrome if the clinical representation and history are typical. So treatment, firstly, there is conservative treatment. In conservative treatment, usually provided to the patient with mild to moderate symptoms. These options include corticosteroids, oral transfer steroids, vitamin B6 and B12, non-steroidal anti-inflammatory drugs, NSAIDs, yoga, carpal bone mobilization, and use of hand splints. It is demonstrated that the patients benefited considerable with the conservative treatment in short term, while in for the long term, their advantages are still remain matter of controversy. The other conservative treatments such as splitting exercise, chiropractic treatment, and magnetic therapy are not shown any significant symptomatic recovery related to the controls. Then the another method is the smash surgery. So in this case, we can see the classic carpal tunnel syndrome surgery in which the transfer carpal ligament is divided. And second case, this is also the case of surgery. This is minimal incision, open of the carpal tunnel syndrome decompression. So that how is done by surgery. So that's about it. Thank you.